Hi, Dr. Leon Popovitz here. Today I'm going to talk about how do you know if you tore your rotator cuff. A rotator cuff tear is a very common injury. So many people suffer from shoulder pain, and very often the rotator cuff is the source of the pain. So how do you know that you're suffering from a rotator cuff tear if you develop shoulder pain? A lot of people wake up in the middle of the night with shoulder pain and they get nervous. What could it be? A lot of people have trouble lifting things up in a closet. What could it be? A lot of people feel weak, that they don't have that same strength. Typically, those sort of things could be many different things. But a rotator cuff tear typically has very set symptoms and presentations. First off, a rotator cuff tear or rotator cuff pain coming from the rotator cuff itself, is usually in this area here, in the deltoid, the big muscle over our shoulder. It's not up in here, it's typically not in the back, it's typically not in the front, it's usually on the side of the shoulder. Very often, people will have pain lifting their arm up. As they raise it, they will feel pain. Or if they're sleeping on it, they will feel pain. And they often will have weakness. If you have trouble lifting something that typically you have no problem lifting, and all of a sudden it feels weak to you or it drops, that very well could be a rotator cuff tear. Now, how could it occur? A rotator cuff tear can occur in a couple of different ways. One way is trauma. You fell, or you had a horrible accident, a horrible car accident, or if you were simply trying to open up a door, or rather a window, and it's stuck, and you pulled really hard, and you felt a sharp pain in your shoulder, that very well could be your rotator cuff. Just happen to have a model here, and this model will show the rotator cuff. So over these tendons here is the deltoid muscle, this big muscle here. Inside are these little tendons, and these tendons are the rotator cuff tendons, and they attach to the bone called the humerus bone, your arm bone, and they will move our arm in all different directions, up, down, forward. These tendons are all around. Above it is the acromion bone, and it has to be pretty flat. But sometimes, as the years go on, people develop little spurs on the undersurface of this bone. So when we raise our arm, instead of smoothly passing underneath the bone, that tendon may pinch and grind against that bone and cause rotator cuff pain. This is called rotator cuff impingement. And it's usually the first stage of rotator cuff disease or condition. If you have a traumatic situation where you fell on your shoulder and the tendon banged up against that bone, well, then that's the final stage of a rotator cuff disease, where it's fully torn potentially or partially torn. But if you have not had any trauma and you develop a little bone spur here and you find yourself having pain when you're raising your arm, that could be that your rotator cuff is pinching against that bone spur underneath your acromion. If that goes on long enough, over and over again, that rotator cuff may start grinding away, and you may develop a partial rotator cuff tear. That's the next stage of rotator cuff disease, where there's a partial tear in the tendon. Those kind of tears don't always need surgery. They often can be treated with conservative treatment. Same goes true with the impingement, that first stage when you're just pinching. Usually the goal there is to strengthen the rotator cuff, strengthen all the tendons in all different directions, and get you as flexible as possible and help with your posture. Make sure all the other muscles are keeping everything aligned so the acromion bone doesn't keep pinching against the tendon. Now, if that grinding keeps going, you may end up getting a full tear of your rotator cuff. Now, the partial tear, again, can be treated with physical therapy, but sometimes it doesn't get better with just physical therapy. Sometimes we have to give you a little injection of a cortisone medicine, a steroid medicine, or an anti-inflammatory medicine, get the pain under control. Sometimes if that doesn't work, sometimes surgery is the next option. But in the last number of years, we've been using something more effective called PRP, or stem cells or plasma cells, where we can inject nutritious cells from your own body, whether it's from your blood or your bone, from your own fat as well is another option, and we can inject it in there, and that causes healing and reduction of inflammation. Now, if the tendon is fully torn, and you're a relatively young active person, or even if you're an older active person, surgery more than not is going to be the best option, but not always. If you still have function, if you still have the ability to raise your arm, you may want to consider physical therapy. You may want to consider stem cell or plasma injections as an alternative treatment. But unfortunately, when there's a full tear in one of those tendons, ultimately at some point it's possible that you may lose that full function and strength, and you may need to have that repaired. If the tear is a small tear, meaning it's torn off of the bone but it's not too far off the bone, often people won't have that dramatic weakness, but they might still. If you need surgery and you wait too long, meaning that the tendon starts retracting, starts atrophying, starts getting smaller, starts shrinking, the tissue is not as healthy anymore, then that tissue may not be repairable if you wait too long, especially if it retracts all the way back there. So for the most part, that is a summary of rotator cuff injuries. Very, very often they are treated conservatively with physical therapy, sometimes plasma or stem cell injections or steroid injections. And if things do not improve with conservative treatment, then sometimes we do have to repair the rotator cuff, and it's done arthroscopically, meaning it's done minimally invasive. We're able to do it through a little telescope that's put through little tiny pinholes. If you have a full tear of your rotator cuff, then more than likely that surgery is a possible treatment for you. But then again, you can still consider alternative treatments before proceeding. I'm Dr. Leon Popovitz. Thank you very much.